Gauteng has several new COVID-19 vaccination sites. Thousands of healthcare workers have already received their jabs at Steve Biko and Baragwanath hospitals. Well, today, Mill Park and George Mukhari hospitals will be starting their programs. Let's check in now with Manqoba Mchunu. He's our reporter who's been watching all of this happen over the past 2 days or so. Manqoba, good morning to you. And let's just first start with the actual provincial picture. What is our plan and where are we on that plan at the moment?
Well, certainly, Yuveka. So what we do know is that the Gauteng province has added more of those vaccination sites this week. In fact, we do understand that some of the private facilities have also come on board in terms of the new inoculations. And those include the Mill Park Hospital as well as the Landmed Hospital in the south of Johannesburg. And these sites, we do understand, Yuveka, will also be rolling out their vaccination programs from today. In fact, we are expecting Mill Park Hospital to start its program around about 3 o'clock this afternoon. But we are here at the Dr. George Mukhari Hospital in Pretoria, and this is one of the 4 sites, the public sites that was identified by the provincial government as one of those sites that will be added to administer this particular vaccine. You recall that, Yuveka, previously we did see Chris Hani Baragwanath Hospital as well as the Steve Biko Academic Hospital being the first to give those inoculations. But since yesterday, they've added Charlotte Maxeke Academic Hospital, and now today, those 2 facilities that will be opening their doors this morning. But in terms, Yuveka, of the provincial rollout, what it looks like in other provinces, what we know so far is that an additional 32 vaccination sites have been added to the list of sites across the country, and this includes both public as well as private facilities. And that's according to a statement that was released by the Health Department last night. You will recall that when this clinical trial started on the 17th of February, there were only 17 sites that had been identified to administer this vaccine. But the department saying that the number has now been increased to 49. And so far, we do know that Gauteng will be receiving 18,400 of those vaccine doses. And the first batch of it, which is 8,520, will be delivered at these particular sites, while another 9,520 will be delivered on the 8th of March. And these will be allocated to the 4 public hospitals as well as the 2 private facilities that have now come on board. But I just want to discuss this further now with Mutale Modibo, who just joined me now, in terms of what things look like here at George Mukhari. Mutale, thank you for your time. Let's start here. The state of readiness, how ready are you here at George Mukhari, and how many of those healthcare workers are expecting to vaccinate today?
Thank you, sir, for this opportunity. What we can confirm is that Dr. George Mukhari, as you correctly said, it's one of the new sites that have been activated. You'd remember that we are still in the early access Sisonke vaccination program, which is still an implementation study, which is led by the South African Medical Research Council. Actually, the sites that have been identified are sites that the MRC has actually identified working in conjunction with us. In terms of today, where we are, there is for the first round, there is a number of health workers that are going to be vaccinated. So today effectively is the first day of operations. You can see that the guys are still getting the system up and running, so that they start with the first group of healthcare workers. I think in the morning today, they're planning to do 60 and then upscale later on in the day to add more health workers that are going to be vaccinated. All in all, in the province of Gauteng, for this second round, what we have received is we have received about 18,040 doses. Of course, we have received half of that on the first, and the other half that you've already mentioned will be received on the 8th. So today the site is being activated, and the other sites as well, they have come live. So it's exciting because the more sites are added, the more healthcare workers would be able to participate in the program. What we do want to appeal, especially among the healthcare workers, is the importance of registering on the EVDS data system, because That's once you've registered on that system, you go through the process of registration until you get a voucher, and that voucher would be linked to a particular site, so that when they go to sites and they are scheduled, then they are able to receive their vaccination. I know that in some other sites we've had challenges where healthcare workers would perhaps show up without having received their voucher and gone through the system. It's just important that they go through that particular system.
Okay, and in terms of Motale, your target here in Gauteng, you are targeting over 215,000 of those healthcare workers. Is it feasible? Are you going to be able to complete this process on time? Sorry, my mask just coming off there.
Look, it is feasible. We are moving with speed, and of course, you would bear in mind that in this phase that we are in, we are dependent on the deliveries as they come in. Remember that the South African Medical Research Council is leading the study, but through the National Department of Health, there's an allocation every time a new batch of vaccines come through. We have already exhausted the previous batch that we had received, which was over 16,000. Now we are, for these 2 weeks, receiving a new batch of about 18,000, which also we intend to complete in record time. So our pace is controlled by the pace at which doses are able to come in, which is a process that is being led at the national level. But ultimately, the Premier yesterday did indicate that we have 215,000 healthcare workers between the public and the private sector, and the aim is to complete those so that when we get to the stage of the vaccine rollout, which is now a public phase, where then all the healthcare workers have been inoculated, so that they can then lead the charge in terms of ensuring that the population of Gauteng is also vaccinated.
Let's talk about these additional sites and what are the logistics looking like?
Look, in the additional sites, I think yesterday we did explain in terms of we've got Mill Park, we've got Linmed. Those are sites that are at the moment dedicated to assisting with the private healthcare workers from the private sector, but they are also linked to other facilities which are public, like your Rahima Musa and your Helen Joseph are being supported by Abu Mill Park and so forth. And we've got the two other sites, which is Dr. George Mukare, and we've got also Charlotte Makrake, which are dedicated to ensuring that we vaccinate your healthcare workers from the public sector. It's a joint collaboration. We're working together. So in Gauteng, all in all, if you count the two previous sites and the new sites that have been activated, you could see that we've got about 6 sites that are active in Gauteng. Of course, the first 2 sites, which is Bara and Steve Biko, now have got lesser doses because they're almost done with, or they're done with the teams that do. Okay, so now they are extending the pool even wider, but they've received a small amount of doses. The focus now is on these other sites. George Mukari, you would know that as a cluster, it looks after other facilities such as your Jubilee and the others that are nearby. So those healthcare workers from those particular facilities will be coming through. Of course, there's categorization in terms of participation. People like myself, who's also a healthcare worker, I'm on category 4. I'm the last category because I'm not patient-facing. So right now, the priority is healthcare workers, but within healthcare workers is to also ensure that we start with those people that are patient-facing, that are actually in the COVID wards and so forth, so that we then get them out of the way. Then we go according to those various categorization. The idea is that ultimately everyone who is within this particular facility will end up being vaccinated. All that I think it's important to note is just for healthcare workers to exercise a bit of patience as we work through the list, because it's quite a large number of people that needs to be vaccinated. But the assurance that the government is able to give is that ultimately everyone is going to get vaccinated. We are still now in the implementation study program, and I think so far it's going well. There are challenges here and there, but I think the team on the ground is well capable to attend to those.
Okay, thank you very much. That was Motale Modiba, who is the spokesperson for the Gauteng Health Department, painting a picture picture of what it looks like here in the province. And Uveka, of course, we do expect the Deputy Health Minister, Dr. Joe Phaahla, to be here at this particular facility, and he's expected to receive his vaccine this morning.
Well, Manqoba, if I can just ask you, seeing as you've been covering the story since yesterday, just in terms of the rollout of these new sites, and we know that there is concern or some doubt as to whether we will meet our end-of-year target, or also whether we will meet our targets by the time the expected third wave of infections hits us. But with the addition of these sites that you've been mentioning, does it seem like we might at least now meet our end-of-March target, where government was hoping to sort of vaccinate about, 1.1 million people by the end of March? Are the experts encouraged? Do they feel that we might just meet it with these extra measures?
Well, Uveka, certainly many of the experts, quite skeptical that we would reach this target, given the fact that, the vaccines themselves, we are still receiving them in very little doses of 80,000 doses, and that's every 2 weeks. So there's quite a lot of skepticism for many of those experts in terms of how will we reach this number, and will we be able to vaccinate those over 1.2 million healthcare workers by the end of the first phase, given the fact that we don't seem to have enough vaccines. But in fact, many of those authorities, the Gauteng officials, as you've just heard, saying that they're quite optimistic. They have received quite a huge response from healthcare workers on the ground who want to be vaccinated. But of course, there is still that concern, Uveka, of those healthcare workers who still say they don't want to get vaccinated. And this is due to some of those misconceptions that we've seen and some of those rumors that have been making rounds upon this particular vaccine.
All right, Manqoba Mchunu, we'll leave it there for now. We'll let you get to the first person getting their jab there, Dr. George Mukhari Hospital. Well,